And welcome back. I'm Mabel Jong. You're watching Day 2 coverage of the World Healthcare Congress in Washington, D.C. I'm in the studio now with Dr. Daniel Varga, who is Chief Clinical Officer at Texas Health Resources. Welcome, Dr. Varga.
Thanks, Mabel. Happy to be here.
Well, tell me more about the work that you're doing at Texas Health Resources.
So, THR is a integrated delivery system in the North Texas market, Dallas-Fort Worth, and the surrounding 18 counties. We're about a $4.5 billion healthcare system there. Our journey over the last I've been there 3 years, so over the last 5 to 7 years has really been one where we've been moving more from an organization that focuses on the acute care health system to one that really focuses on population health. Kind of same journey that a lot of different health systems are going through. We've, as part of that journey, we've just recently completed an affiliation with the University of Texas Southwestern Medical School, which now creates a 27 hospital system with about a clinically integrated network of around 2,500 physicians, an extended physician network of about 3,500 physicians, big presence in Medicare Advantage, big presence in Medicare Shared Savings programs, but really moving from classic volume to value, acute care to community-based population health, moving from kind of the sick episode to really experience-centered sort of care delivery model.
Okay. And have you found that there's been a lot of transitioning that you've had to do at Texas Health, as most in the industry are trying to figure out who to partner with, what services to provide, and how to pay for them? Are you in that same position?
We are. And, you know, interestingly, if you were to describe the North Texas healthcare landscape, we're pretty expensive. Quality is about average. Patient experience is about average. And all the health systems are actually doing financially really well. So with a growing economy like North Texas is right now, a growing population base, there really hasn't been a lot of the demographic drivers that you've seen across the country to really drive consolidation of the market, integration of physicians with health systems, the creation of large physician groups, et cetera. It's still very much kind of a early to mid 80s kind of clinical marketplace. Very strong clinical capabilities in the market, but not the kind of consolidation, integration that you've seen in California, on the West Coast, in Florida, and some of the other more consolidated markets.
Okay, so what does that say about the progress of consolidation, if you will, in North Texas? I mean, it doesn't seem like it's headed in the same direction as what we've seen in other states.
You know, I think it will. I think we will move that way. I think it gives us actually the opportunity, kind of talked about it this way from time to time, which is we're so far behind that we may actually be ahead. Meaning that there's not lots of kind of evolutionary structures that have evolved like have occurred in other sorts of markets. So we may well be in a position where we can simply say, look, if we've got to configure for a marketplace in the future that's going to be far more accountable, far more transparent, far more based on a risk-based type reimbursement, let's just do it. Let's not go through transitional sorts of phases. Let's just move straight to that endpoint and start developing the capabilities and the culture to really be able to get after that. Mm-hmm. And that's really what we're trying to do with the newly configured relationship that we have with Southwestern, which is called Southwestern Health Resources. We really think it'll be a real agent for change in the marketplace there.
What's the message you're leaving with attendees at this meeting?
A couple things. You know, the session we did earlier today was really around the consumer experience. And I think, you know, one of the really core elements of being successful in population health is developing the capability and a culture to be able to meet consumers where they are. Mm-hmm. You know, we've we've been pretty good at being flypaper, right? We just sat there and people came and stuck to us. Yeah. They came because they had to be admitted to the hospital, they came to deliver a baby, they used our ED, whatever it happened to be, and then we became kind of the locus around which their health care kind of revolved. In a new market where folks are looking for value, where they're connected to everything, they got wearables and all sorts of other things that they look at and kind of monitor their well-being with. How we get those inputs, how we meet those folks, you know, who are still well, where they are, get them engaged with the health system, kind of become their navigator of healthcare, is, I think, really the destination we're heading towards. We're going to rely on people, process, technologies to try to make that happen. But I think more than anything, it's going to become a dialogue with the community as opposed to a billboard or a flashing light that says emergency and show up here.
All right. Well, why did you think it was important to be at this conference this year, Dr. Varga?
You know, I think the landscape's changing very, very quickly right now. We all know that the healthcare system that we have today is not affordable into the future. It's not sustainable. We know that the public is asking for more transparency, more accountability. And we also know that we're probably, from a technology standpoint, more enabled than we ever have been. What we really haven't done is bring that kind of process level change management, change transformation that is really going to be required to make this happen. And this is a place where you've got all sorts of folks, you know, large systems, small systems, academic systems, medical group practices, vendors, technology companies, and a really great place to exchange ideas.
All right, Dr. Varga, such a pleasure to speak with you. Thank you.
Thank you, Mabel.
And I'm Mabel Jong. Stay tuned, much more to come.